All right, so this is just another test of a platform here. Um, but please note that persons can ask questions right here as well. Whitney can do the same thing. Just let me know if you're seeing and hearing us in New York, and you can ask your question. I'd appreciate that. Thank you. All right, so today on the live checkup, of course, you know how we do it, either Wednesday or Thursday, and it's Thursday. Doesn't my skin look glowing, Asante? Anyway, so we are speaking about, as my title says, and let me get it correctly, how COVID-19 really impacts persons with diabetes. But obviously, we can't just jump into that conversation just like that. Yes, we are living in a COVID world, but we need to find out more about COVID-19 as well as more about diabetes for some of us who may have missed the info pertaining to it. And that's why, as always, inside the live checkup, we have to get the info from the woman herself, Dr. Asante LeBlanc. She is the owner of Victoria Clinic, which is on Gala Street in Woodbrook. She'll give you the full, did I say Woodbrook? Is Woodbrook? I hope so. But she'll give you the full details of the many services that they offer at Victoria Clinic.
Diabetes mellitus or mellitus is a metabolic disease, and it's a chronic non-communicable disease. It's divided into type 1, type 2. Type 1 is insulin dependent, meaning they do not produce insulin. They need insulin in order to be balanced. And type 2 is non-insulin dependent. What is insulin? Insulin is a hormone that's secreted from the pancreas, which is an organ at the back of the body. It's behind the liver gallbladder area. And it secretes from the beta cells. We get insulin. And from the islets of Langerhans, which is a part in the pancreas, we get insulin. So the pancreas also produces glucagon. So between insulin and glucagon, it manages your blood sugar levels, right? So it's called your glycemia. So diabetes is when there's an imbalance and poor control of your glycemic levels, right? And your metabolism of your carbohydrates or your sugars, basically. With type 1, we see it a lot in younger appearing when you're younger, and usually appears with you have to have insulin because you're not producing any. With type 2, it develops late, although you may have what we call late onset juvenile diabetes, which is a type 1 diabetes that came up late in life.
How late is late in life?
It can come up in your 20s.
That's a type 1?
Yes, the type 1. Yeah. So the type 2 is lifestyle based. Depends on your lifestyle. It depends on your genetic factors. So mommy, granny, daddy having diabetes. It depends on your activity levels. Are you sedentary? Do you exercise? Your cholesterol levels. It's related to even the triad, which is hypertension, diabetes, cholesterol, which we've always discussed. The quadruple, because obesity is also another one to add to that triad. So it's no longer just a triad. So type 2 diabetes is the one we're very concerned about, because it's something that is modifiable. It's due to risk factors that are modifiable. This means you can be, as the patient, as the individual, you are proactive and you can make a change. You can make a difference if you do it early enough in life. And that is why, for example, both of my maternal grandparents are diabetic hypertensive. And therefore, I can make a decision and be proactive so that I can offset developing it. Or if it does develop, so I can't break my genetic code all the time, then at least I will not need as much medication. I may not need medication at all, because type 2, you can even be treated with just lifestyle. Yeah? So this includes stress coping, sleep. All of that is in lifestyle, as we've discussed many and many times before. Yeah?
So diabetes, as you mentioned, so you just broke out basically the type 1 and the type 2 for us of diabetes. But diabetes is one of those non-communicable diseases that we constantly hear is one of the concerning factors with COVID-19. right? Now, before we go into that, I want you to you mentioned some things, and I know you love to talk about balance. So, if you can tell us about to deal with diabetes on a whole, if you already have it or have this pre-diabetic stage you're in. So, let's talk about dealing with that. But I want to know later on inside of our conversation, so I'm inviting everyone to stay on, how if you can speak about how COVID-19 impacts persons with diabetes, because I know there's this talk that people are asking, are people with diabetes more likely to get COVID-19? And of course, I was seeing on American Diabetes Association, they said that is not the statement. People with diabetes are not more likely to get COVID-19 than the general population. However, they still want to pay attention to those persons because there are some problems problems can arise even worse for them being diabetic. So, you just mentioned hereditary. It's in my family. Speak to me as you would speak to anyone coming into your office about the possibility of what I need to do, which is why I'm decked like this today. I'm going to do my walking, so I'm getting the exercise in. So, what are some of the changes we need to apply to keep it far off? Or even for those persons who have it, how they can deal with it healthily?
Well, I mean, Jenny, the first thing I think patients need to understand is when you are in your 20s, that's when you start your relationship with your family doctor, because your mom used to take you to the doctor, the pediatrician, all the time.
Right.
So when you become a big person, an adult, so to speak, you have to take on the responsibility of finding a GP or a family doctor that is your fit. So that's important, that it's somebody that's your fit. Every year, your physician would measure your vitals. So height, weight, blood pressure, fasting blood sugar, cholesterol, depending on what family history you have. But those are the basics that will be measured. Based on that, as a physician, we would advise exercising at least 3 to 4 days a week, at least 30 to 40 minutes of cardio or aerobic exercise. Eating healthy, balanced meals, which is, if you look at the different plates, you'll see the protein, the carbohydrates, the greens and vegetables, the fruits and veggies. Understanding not to eat as much processed. I would like to say no processed, but it's very difficult to say no processed. So I usually say limit the amount of processed foods that you put into your body, because the more processed the foods are with our lifestyle, they have a different effect on our cells and our bodies on a whole. So that's why we try to avoid the process. So we came from a stage of cooking every day, using our local foods. Dare I say what COVID did to us before they opened the restaurants, right?
Because we're back in
and then women started to work. We had a women's revolution. We had to work, we had to manage things, and then things had to be quick. So it was pop this in the microwave, pop that in there, do this frozen food here, and everything like that.
Quick.
And things became more preserved. I mean, I grew up on a cow farm, and instead of my milk coming from a cow's udder, now I get milk off the shelf on a box in UHT if I choose to buy that milk, right? So these are changes, you understand? Brown sugar, and then we went to white sugar. Why do we need white sugar? And therefore it's processed to make it white. Then we went from whole grain flour and our regular flour, but then we had a population explosion, and therefore the food industry had to figure out how to feed the whole world. And they genetically modify the wheat. You genetically modify the wheat, you process it, you take out and you nutrify and you fortify and you denutrify. And therefore, once again, you cause problems and everybody think all food is poison, right? So this is a never-ending story. It's very agitating because we can now recognize how much damage so-called development of our species has done to our own species. So development has brought with it damage, right? And that's why COVID is a huge reset. And that's a whole different conversation.
Yeah.
But all of these factors, along with lack of sleep, poor stress coping, and now with COVID, guess what? You can eat natural food, but now you don't have a job to buy the food. You understand? So you have stress coping, you can't sleep. So all of these things, which is why we've been talking from day one about exercising, about mindfulness, about living within and understanding how you can cope. Because if you are not mentally prepared for this struggle and this new obstacle in what we call life, then it's going to break down eventually. You understand?
Yeah.
So, this is what we've been talking about. So, diabetes, before COVID, any diabetic was at risk for infection because if your blood sugars are not controlled properly. So, this is what I say to patients: you're not diabetic. We don't want you to become diabetic based on your family history. Please don't drink excessively. Please don't smoke. Please don't eat fatty foods all the time, fried foods. Have your foods grilled. We go through the whole thing. How to eat, your glycemic index of foods. We will give you the pamphlets. What do you have to do? Now, let's say you've developed diabetes, God forbid. Now that you've developed diabetes, we have to monitor your fasting blood sugar. We have to monitor your HbA1c, which will tell us what your blood sugar was, your blood sugar control was 2 to 3 months retrospectively, so in the past. So you can't lie. You know, those who go into the doctor don't eat and say, so when they get our fasting blood sugar, it's normal. But then when I do the HbA1c, I'll know how normal you were in the past 2 to 3 months. So then I'll be like, no, you're lying. You have doubles every day. You had the Sahina Debe. You understand? You had all of that.
Why do you sound like you're throwing something down south?
Because you put that video up today, and I think it was just brutal. Anyways, so and everybody knows that I like Sahina, so let's not worry about it. So we tell you how to live, but if you do not have proper blood sugar control, literally picture your blood as syrup. So if you get cut, diabetics get are more prone to infections.
Yes.
If your diabetes is out of control, then you have complications. And we talk about microvascular and macrovascular complications. But one of the major complications is that you can have what we call peripheral neuropathy, meaning you don't feel on your feet anymore, right? So that's why we have diabetic ulcers, because they don't feel when they've cut their foot. And they don't notice. So that's we tell them to have a proper foot health and to make sure they're looking at their feet, because they can develop infections on their feet, and before they know it, it's gangrenous. It's totally infected. So diabetics are also more prone to pneumonias. I almost spoke Spanish there. Sorry.
That's all right. We have that complication as well.
To pneumonias because again, your immune system is affected by poor blood sugar control. Right? So we can go on and on. So this is why they're more at risk. As we spoke with COVID, when we started speaking about COVID, who was at risk and why they were at risk, and diabetics are an at-risk group if they get infected. Not to get infected. They're at risk if they get infected. Yes. Because if you get infected, you already, if you do not have proper blood sugar control and strict blood sugar control, the chances, first of all, any infection throws off blood sugar control in a diabetic. So let's say you weren't controlling yourself properly, you get infected, you already have poor control, and it's thrown off because your body is in an inflammatory state trying to fight the infection, right? And therefore your blood sugar gets worse, and therefore we're treating the infection and your blood sugar control. So that is when you are more likely and more prone to develop more complications. So that is why diabetics are more at risk if they get infected by COVID-19.
So you literally just dissected that exactly, because I was wondering, if you have diabetes, do you get it? But it's just a higher risk, as you say. Another question: do people with diabetes how you talk about?
I'm sorry, I'm scratching my eyes, and this is because it is Sahara dust. I know we're not supposed to touch our face, but please excuse me. Yes, sorry.
You're getting so much breeze up there. So, all right. So since you spoke a bit about nutrition, you spoke a little bit about exercise, the importance of exercising. Even you just highlighted, as we've delved into the COVID part of our conversation pertaining to diabetes, that for a diabetic they have a higher risk. Yes, would that be because of some of the things you just spoke about, the pneumonia, even the term you use for not being able to feel if something is wrong,
peripheral neuropathy.
Right. So all these things can worsen.
So if they get infected by COVID, because if they don't have strict diabetic glycemic control, then they're already at a disadvantage with an infection. And so COVID is just another infection, but it's worse. You understand? Because of what COVID is doing to the body.
Well,
So
let's
that
speak
is
about
the
how worse
problem.
it is, because for those persons, and there may be persons that don't get it, let's be real, even though we've been eating, sleeping, and drinking COVID, what's the difference between the COVID 19 versus a seasonal flu?
But there is no difference. Well, the difference is the what we call the pathogenicity of COVID versus the influenza virus that is coming around now, the seasonal flu. So the diabetic is at risk for the flu as well. It's not only COVID. The
Yeah, yeah,
diabetic
yeah.
is at risk for,
Yeah, yeah, yeah.
you understand? But because COVID's pathogenicity, its ability, the armory that it has, the artillery, the weaponry that COVID comes with is what makes it worse for the diabetic.
So are there
Because
any.
COVID can do anything. COVID can, as we are seeing, COVID is mutating, and therefore COVID can come into can infect a diabetic, and the diabetic, it may just be a strain of COVID that is extremely pathogenic, and therefore it will take over. And the diabetic, if they had poor glycemic control, they already have a problem with their immune system, and COVID just causes more problems because their immune system can't deal with COVID.
So we don't want to have have to deal with diabetes and COVID 19.
No, because if you're then intubated, God forbid you can't breathe, and your blood sugar is going up, which then impacts on your ventilation. So it's a catch 22, and it's like the cart or the horse. Which one goes? And it's complication after complication. And then if you go into acute renal failure because of COVID, because of the diabetes, so it's an immense healthcare problem.
So my question
An
to,
immense healthcare
so
problem.
my question to you, Dr. Asante LeBlanc, I'm sounding like if I'm on radio here now. Are you saying that we need to have more discussions or more information, especially targeted to those non communicable diseases, persons who may have those diseases? Because I'm not going to call persons, but I know persons who are diabetic and even hypertensive, but I don't think it registers to them how serious this is and how horrible a process of recovery it will be for them because they have diabetes or hypertension or whatever the other non-communicable diseases are. Do you think we need to have more information pushed out to the general public about the major effect of, let's say, because we're talking diabetes, pertaining to diabetes and COVID 19?
But the problem is it's a novel coronavirus. So
But at least you are breaking
we're
down.
speaking from right, but we're speaking from a position of this is a high risk group of individuals: the cancer patients,
Yes.
the hypertensives, the
Yes.
diabetics, the obese patients, asthmatics, chronic respiratory ailments. All of
Asthmatics.
those are
Forgot them.
the high risk groups. So
You touched on that
those that
case.
have chronic non-communicable diseases in our environment, which is hypertension, diabetes, dyslipidemia or cholesterol, obesity, cancer, asthma, those that have those diseases, they know they're at risk, but we don't also want to overstress them because guess what? We don't
Okay.
have all the evidence.
Okay.
So all we can say to them is you are at risk if you get infected.
Okay.
You are at risk for more serious complications. So we want you to practice what we're saying
Right.
so that you don't put yourself at risk for infection and therefore for serious complications.
So we don't want to
You
panic them.
understand?
I understand.
You
But
can't panic them,
and that's not what I'm
because at the
saying.
end of the day,
And
yeah,
that's not what
but
I'm
at the end of
saying.
the
But I just
day,
wonder if many persons in that fall in those categories, and because I know too many of them not taking it serious. Look, at some time, we just think it's. I think many of us are still thinking COVID is flying over our heads. You know what I mean? Generally. So I just was
but that
wondering
is
about for and those people with those high risk factors.
but those who who have those chronic non-communicable diseases that are not taking it seriously, then they don't take their disease that they have seriously.
Seriously. Okay.
So that's a whole other conversation.
And that is
And that's
true.
a tongue lashing, and that's a plan assing. That is a
Anyway,
bad,
this is
bad
social media. We
conversation.
can say those words.
But it's where you get licks. This is when your grandmother put you over her knee and beat you. Because if you're not hearing it, because we're not at fault,
We're gonna
we keep
fail.
reminding people about those diseases and about the impact of those diseases on your lifestyle and on the quality of life that you'll have. So, but I get you, JD, and I would never stop speaking about those diseases because, for example, we will never stop speaking about hypertension, high blood pressure, diabetes or sugar, cancer. We will never stop speaking about those diseases, obesity or selective plumpness, because those are a fabric of our population right now,
A
unfortunately,
large fabric.
due to poor lifestyle choices. Yeah.
Yeah.
And so we cannot stop the discussion, but it is up to an individual to take on and be proactive and be responsible and accountable to their body and their selves about their illnesses. So a doctor is only your guide. A doctor, you are the protagonist in that show. And I've always said that. So if you come and you know your mother, your father diabetic, your grandparents on both sides diabetic, your aunts, your uncles diabetic, somebody lost a foot, somebody lost a toe, somebody had renal failure, somebody had a heart attack, somebody had a stroke, and you come to me and you're eating, I'm not going to call names, you're eating fried chicken and fries every day. You're eating doubles on the corner with a Coke or an Apple J because that is your veggies for the day because it has cucumber in it and you're happy with that. And then you go home and you're having a nice white bread from somewhere else or a hops and ham every day. Then if that is your choice, I, I have to let you say if you don't hear, you're going to feel. You understand?
Yeah.
But we will continuously remind you it's not about making huge changes. It's small changes that have with that a huge impact and a positive impact on your life. Stop smoking, drinking
Took my
responsibly.
question.
That means not over drinking. Sorry, I read your mind. You know, and JD, this doesn't mean that I can't have a doubles once a month. It doesn't mean I can't have fried chicken and fries if I want to. I might fry my own fried chicken and fries. And COVID has made a lot of us into fried chicken experts.
Yes. And
Um,
doubles expert
but
too.
but
Mm-hmm.
instead of the Irish potato, use the sweet potato.
Mm.
Buy local. Use your fruits. What is in season? The watermelon, the pawpaw, the mango, the grapefruits. The citrus is going out of season, but limes are coming in. Um, you know,
Lemon.
you have to use the veggies, your pak choy, your karayla, what I call it karayla because I'm Guyanese, the karayli according to the Trinis, the peppers, the cayenne peppers, the lemongrass, the onions, the garlic, the fenugreek or methi, the tulsi, all of these combined can lead to healthier lifestyles and healthier eating, and therefore allowing you to have a better lifestyle as a diabetic or hypertensive patient or pre-diabetic, if you want to call it that.
I mean, it is just when you think about
I've exhausted you.
no man, when you think about the changes we have to make, and and sometimes I think about you know you just mentioned replacing the Irish potato with the sweet potato. It really is not a difficult task to just swap out the bad stuff with the good stuff. It is not a difficult. It's really forming a new habit, isn't it? And habits are easy to form. The bad ones, so we can certainly form a new one easily.
and
But
and that's the thing. Yeah, that's the thing. So for example, you get fish from the market, you can steam your fish, curry your fish, you can have your fried fish if you want it. Like I love fried fish and pepper, but I will fry my fish crips 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 as we say with my pepper home, or my loud sour, who is a Guyanese would understand that. You understand? But I don't eat that every day. I'm going to have my steamed vegetables. I'm going to have my salad, my cucumbers, my tomatoes, my lettuce, my onions. I'm going to have my fresh fruit. I make a green mango salad sometimes. You have to be able to see how And to me, COVID has allowed me personally to sit back and say, but I can do this.
Many
I can
things.
incorporate this into my lifestyle.
Many things, eh?
I can exercise and I don't have to use the excuse of I'm busy. I can wake up early enough and exercise, or I can force myself to do it in the evening. Because the reality is, we will go back to a lifestyle of traffic. We will go back to a lifestyle of stress, more stress than now. So we have to prepare ourselves for that phase by phase. We have to prepare our bodies for that phase of normalcy, so to speak.
The new normal.
The new norm. The new norm. Because the new norm means the mask, the physical distancing, the washing of your hands, plus the cooking of your own food. Because I am not knocking the restaurants, I am not knocking the fast food outlets. I am just saying you have to take control of your intake and your diet and your life. And now is the time to do it. Now is the time to do it.
Now is that reset that we're embarking on. So
the reset that we've been speaking about all the time. You know, I have my mentors I have a mentor who has gone vegan, and I tell him I'm a carnivore, I'm an omnivore, I can't do it. But it's not about can't, it's about understanding what your body can take. So while I'm an omnivore, I won't eat red meat every day, all day. You understand?
Yes.
But I will eat my fish and I will eat my veggies. And maybe there are 3 days out of my 4 days out of my week that I might be a vegetarian. And then 3 days that I will have some sort of animal protein. So you have to be comfortable with your lifestyle. And you have to phase in your lifestyle with your comfort level. Everybody can't be the same. That's why we're called individuals. However, the food industry is responsible for a lot of what is happening to our bodies as well, because things have changed. And therefore, while we could say, well, we didn't grow up as vegetarian, the food industry may have now forced us to be that, because that is the most local and natural thing to put into your body. But then, do you know your farmers? Are they using pesticides? Are they using certain fertilizers to grow the pak choy from 0 to 110 days? So you have to know. Even a vegetarian has to understand what they're putting into their bodies.
Well, part of that process of knowing certainly involves us becoming gardeners of our own. And you have encouraged that before, getting into our own garden and doing our own green kitchen garden, from planting your pak choy. I'm seeing persons cucumbers, all these different things that will help the process. And I guess the reason why too with the restaurants, I mean, not downing them. Remember, they're making from mass production. So, and longevity on the shelf. So they would incorporate the pesticides in farmers' case, and the different things, chemicals, to keep that longevity of that thing that customer needs to buy. Because we have pace. We don't have time to waste, you know. So I guess you are correct. This COVID-19 is certainly going to make us dive into not only being gardening, becoming chefs again, like long time when granny and mommy used to do it. We're going to have to dive into those just as part of, even as we're dealing with diabetes, of dealing with oneself, you know, and making sure that we're staying healthy. I want, you must bring your herbs into this conversation about diabetes. You must. So as we speak about diabetes this afternoon, guys, if you're just joining us on my website, this is something we're trying for, a new thing we're trying, because I have been spending all day trying to find ways to get it across a large audience. And this is certainly one way we can do that. I still have to master getting your comments and your questions, so just bear with me. One thing COVID is doing is making you learn to do things you've never thought you would be able to do before. So I'm getting IT-ish, you know. Can you speak about what sort of food should we be eating? Not foods, I'm talking about herbs, in terms of the ginger and the turmeric. Just someone today asked me about turmeric, ginger, and aloes, and I said, I don't know about that. I gotta ask my doctor about that one. But so many people are going into these concoctions of healthy stuff. Can you touch on some of those that will help those diabetics or pre-diabetics?
So some herbs that can be used, and then again, it's always good to be in contact with a certified medical herbalist, to be in contact with your physician, because so please note that the information given on this platform is not meant to be the only thing available. It's not meant to be your guide, because there are ways to do it, there are doses and so forth. So herbs that have been known to support blood
Support.
sugar
Yes.
metabolism. I prefer to use that word.
No, I do like that word, support. I'll be stealing it.
Include fenugreek or methi, cinnamon. So methi is from down south, Miss Lady. Yeah.
That's another
So
thing from
methi
down here.
yes. um, Tulsi as well is noted. Neem, if you remember neem, when your grandmother used to say your blood too sweet, and they need to clean out your blood with some neem bitters.
Yes.
So neem is a very good supportive herb. Cinnamon is very very good as well. Um, Ginger and turmeric, yes. I'm thinking again, fenugreek, cinnamon, tulsi,
But
goji berries
of
are
course, you're
also very
mentioning
good.
these things,
Goji
but tell
berries
us
are not
about
local.
how often we should be using them as well.
So everything is that. So it depends on how you're taking it. Is it a capsule? Is it a tea, a tincture? So most of it, and if you're eating it in your food, because you can actually cook some of these things. So I always recommend to have a dose of 2 to 3 times a day,
Right.
a tea of two times a day. Again, the dosing depends. If you're doing a tincture, you can have the tincture twice a day. And you can use tinctures. Sometimes I prefer to support a diabetic with a formula versus one herb, because from a Chinese medicine perspective, diabetes is a syndrome, and therefore has different meridians that need to be balanced, and different patterns that we would see in traditional Chinese medicine. And therefore, we can create a formula to support that. And therefore, again, from a Chinese medicine perspective, we'd be balancing the meridians and balancing the body, and therefore supporting better glucose control, blood glucose control, and metabolism.
This is
So if I was to say to a diabetic, they wanted me to say, what can I use? I'd say, well, eat some Karaili. You know what I mean? You could take the wild Karaili bush and you can boil it. Stinging nettle as well can
oh
help.
yes.
So it depends. So it really depends. So I mean, if somebody comes to me and says, I'm diabetic, is this good for diabetes? I'm like, well, I mean, I could say yes, but then, we have to look at different things. We have to look at the patient's tolerance for the herb. We also have to look at if that is really what is needed. But something like fenugreek, for example, has been noted to support the insulin production in the body. But what is the problem or the situation with herbal medicine is it depends on where your herbs come from. And remember, herbal medicine will never give you a constant. It depends on how the herb grew. Where did it grow that season? How was it picked? How was it dealt with? How was it processed? Was it processed? So all of those factors come into play. So herbal medicine will never be able to be fully regulated and for example, stated in 12 hours, this is what's going to happen.
Right.
And even medication can't do that. They try their best, but it can't be precise. So this is where you have to understand that these herbs that I've mentioned and these foods that I've mentioned help to support the body on the whole. And it's best to see a certified medical herbalist, because they can then see what patterns exist and understand what it is that's needed, and then you're monitored by that person. Excuse me 1 second. Are you okay? Oh, sorry. And so you will monitor that person, see what is needed, see how they're feeling. So it's not just about you saying, oh, well, I'm going to drink neem every day, or I'm going to eat 3 neem leaves every day. That's not going to make sense.
Okay.
You understand? Because you need to have proper control. You need to be monitored. You need to understand. And then remembering that everything is different. So let's say one time you get a cold or you get some kind of infection, then the neem alone might not help you. You might need something else added. You understand? Grapefruits help a lot. So they're foods, they're herbs, you bring them together, they can support the body, but you may need medication. So that is why it's important to be monitored by a physician and a certified medical herbalist.
Of course. So as we get ready to wrap it up in just a few minutes, I want you to I know this is one of your passion discussions, obviously being a doctor, living in this pandemic along with us. But can you just also just tell us again the reminders pertaining to COVID-19? I don't know if any new thing has come up, meaning we're getting a vaccine next 2 months. You think maybe next 6 months? Out of the doctor world, out of the medical world, what do you have to tell us? Same thing.
It's the same thing. I think it's important to understand physical distancing, understanding that it may, and I think it's something important to recognize. We will never always be able to be 6 feet apart. I'm going to have to pass you in an aisle. I'm going to have to pass you somewhere. So we'll never be totally 6 feet apart, but try your best to be 6 feet apart.
Yeah.
Right? Use your masks. Use the appropriate masks. Use them properly. Don't use a mask with your nose out or on your chin, because that's not going to make sense. It's best you don't have anything on.
Sorry, today.
Understand how to wash your masks every time you use them for the day. Understand if you use a disposable mask, how to take it off and how to put it back on. For example, if we have, as doctors, have to eat or drink, sometimes we take it off, we throw it away and get a new one, or we know how to take it off and we know how to put it back on. Yeah? Washing your hands with soap and water, we've told you for at least 20 to 40 seconds.
Yes.
We've shown you videos on how to wash your hands. You can check out the Facebook page for Victoria Clinic as well. Understanding that if you're going to sneeze or cough, it's into the crook of your elbow. That's the polite way to do it now. Understanding that you can use alcohol-based sanitizers in case you don't have access to soap and water. Use your masks. Now we're opening back up slowly from a medical standpoint, so those who have to get their checkups and so forth can most likely make appointments to see their doctors. But remember that when you go to see your doctor, first of all, your temperature is going to be taken. You have to wear a mask. As soon as you get into that office, go and sanitize your hand or wash with soap and water. You have to be socially distanced, no more than 5 people in a group. Follow those public health regulations and advisories. And this is to reduce transmission of the COVID-19 virus or the novel coronavirus. And that's all we can do.
Unfortunately, I did not catch the press conference today. Don't know if you did, but I missed that today. But I'm sure, thankfully, we're still at this location where we don't have any further numbers with COVID-19. Unfortunately, we lost 8 persons, and 8 family members we're talking about, grieving right now still. But when you look at our numbers compared to the world, right now we're doing pretty well. But we still don't want Trinbagonians to use this as an excuse to become slack, if I can say that term, or just nonchalant about it. So yes, we need all those things you mentioned. We need to continue doing that. Just today I saw 2 gentlemen walking with the mask under their nose. I don't get it. So I just don't get it. So still, we need to continue to educate. I don't know if it will sink in, but I hope it does.
It's a difficult thing to get accustomed to, but it's something that has to be done.
So let me just ask you this final question as a doc, because I heard it was on discussion on television last night. I don't know if this is putting you on the spot, but I'm getting ready to go walk, guys.
Exercising with a mask.
I tried, Dr. Asante LeBlanc. I tried yesterday. God knows it was so difficult to breathe. And you
because heard the masks are not meant for you to exercise in. So that is why it's been advised that if you're going to exercise, it has to be with not a lot of people around, and don't use the mask, because you may not be able to breathe in the mask. Or get a cloth mask, which might be more breathable, but it's going to be difficult because the carbon dioxide that you exhale is going to be there. So my personal advice is do not try to exercise in big groups outdoors right now, and try and use exercise indoors as much as you can, or in your facility.
I'm just walking with my friend, and it's 2 of us, and it's really a clear area around the streets right here, so it's not crowded or populated. But we still were trying to abide by wearing the mask, and you're like, oh God, and we have hills. So even going up the incline is quite difficult.
I would say pray that you don't see people
Yeah.
because pulling down the mask and putting it up makes no sense.
Makes no sense.
So
Great.
it's a very difficult thing. I'm now looking into masks that can be worn by athletes. And that's obviously something that's going to come because you're going to need the masks with the filters to help you breathe better, but will filter out the pathogens, the bacteria, and the allergens. And those, it's going to come. But right now, like I wouldn't go and exercise with a mask. I can't. Much less an N95 mask. I mean, just walking around my office with an N95 is killing me, much less if I try to go up a hill. It's just too much carbon dioxide for my liking.
Well,
but it's a new norm, and you have to see what's best for you. I personally exercise at home.
Well, I saw there are a couple of stories of persons that died as a result of it in China. A gentleman wearing it after 2.5 miles, I think he was running or walking, and he collapsed. So you do have that risk factor there.
Well, if you wear a mask and you're exercising and you start to feel dizzy, you should take off the mask
one
quickly.
time, pronto. All right.
I don't see why you would keep the mask on.
All right. So I know you got to go and I got to go too in just a bit. Tell us in your final words on the live checkup today, which is on my website. And trust me, I'm going to work on it, guys. I'm going to see how we can get it on the Victoria Clinic page too.
It needs to go on the Victoria Clinic Facebook page.
Tell us about anyway your location and how we can get in contact. Because you are open. Do we have spots at your?
We are open for appointments. We have select days. So if you check out our WhatsApp has information, which is 741-7515. And that has information, and we can be contacted at also 290-8908. Those are the numbers right now. Our office numbers are also available, which is 622-2221. It's all on our Facebook page and our website and our Instagram page, which is Victoria Clinic _Trinidad. We're at 54 Gala Street, Woodbrook. You can contact us. You can send us an email, a message. You can contact us in many ways, and we'll tell you how to make an appointment and the requirements and what can and cannot be done right now. But we're slowly working into phasing back into full groove.
Are there any new things on your Instagram page? Because I know you're very active now with your videos and stuff. So
I'm putting out my back exercise videos soon. And we're soon going to put out some. I put out the I launched my garden teas again for a friend of mine, so she's going to be launching that, and I made some teas for some hibiscus, ginger, and rose tea. I made that this weekend for her to sell. And we're going to be putting some videos on acupuncture soon.
Oh, great.
So I'm going to have my co-host be my model while I show you acupuncture and cupping.
Can we share that somehow on this side as well? Because I know you mentioned it with the back pain last 2 weeks. So how can we?
Yeah, so you're going to get the videos from my Facebook and Instagram pages.
Produced already.
So then you'll be able, they're not produced yet. I have to get the model.
Sorry, when I mean produced, it's not going to be live. It's going to be recorded.
Yeah, because my model live is not going to work. I have to make sure she's ready.
Okay.
But strangely enough, JD, I wanted to tell you that we did that carpal tunnel episode.
Right.
And if you can put that up again, or if you can find that somehow to post again, because that carpal tunnel video, I got patients with carpal tunnel the next week. So it's definitely something that's happening. And then the other thing is that I do my tip of the week. So the tip this week was about, I think you saw it. What did I speak about this week? Oh, passion, sleep. I spoke about anxiety again using rosemary and passion flower. So my tip next week, I don't know yet what I'm going to tip about, but I'm just trying to stay active and help as much as I can.
I like that. And that's your Instagram page?
It's my Instagram, my Facebook. Yeah, that's where my tips come out.
Very nice. And soon we'll have the live checkup page, and you can find them there too. Okay, guys? Watch me. This free time is allowing me to do many things. So.
Oh my gosh, will not be great. Yes.
So I'll certainly work on that soon. I'm just trying to make sure everything happens. And you really need to try and pool everybody in one place where they can see, and that's just a challenge for free. So thank you so much as always, for our chat. Shall we do this?
Thank you.
I know you're a very busy person, and I really respect you for giving me your time. You didn't have to, and you do that. And you stuck with me all these months. Thank you so much.
No, you're most welcome. My pleasure. I think we're on for next week, Thursday. I mean, it just depends on how the situation rolls, but I think we should be fine.
Nice. Thank you very much. Have yourself a good afternoon. And thank you.
Bye. Thank you.